Hello again, everybody, and welcome to another Inside Lowell podcast, another Health Minute brought to you by Wellpoint. We are coming to you from the Wellpoint studios here in downtown Lowell. Wellpoint is the only health plan offering benefits exclusively to Massachusetts GIC members. At Wellpoint, your whole health is their whole point. And we thank our friends at Wellpoint for making this Health Minute possible and for making their medical director, Dr. Carolyn Langer, available to us yet again. Welcome back on this November day, Dr. Langer. Always good to have you here. Always informative to have you here as well.
Great to be back. Thanks for inviting me, Teddy.
I'm excited to have you here. Actually excited because this topic is one that is kind of, with the situation in emergency rooms now, I feel is very important. And a lot of people are expressing kind of concern and frustration about it. And that is, where do you go for care, especially if you don't necessarily need to go to the emergency room, where it seems like everybody is kind of going for care these days, right? So there are other options, right? And there are a number of good options as well, right?
There are. So certainly if you're having a true medical emergency, absolutely, you should go to the ER or call 911. But there's so many other good options these days. So it's important to understand what these other choices are, because they can also save you significant time and money. So for example, if you have a sudden need for medical care that doesn't absolutely require that you go to the emergency room, think about contacting your primary care provider. Sometimes they can provide you with a same-day appointment or a next-day appointment if you feel it can wait. Another great option is virtual care. So having a virtual visit with a provider. Sometimes this provider might even be your own primary care provider, but many health plans, including Wellpoint, do provide access to a vendor that provides virtual consults. And then another option is going to an urgent care center or a retail health clinic for non-emergent medical conditions.
I guess really the trick is, because that is a lot of options, and it's a lot more than we had even a decade or 2 decades ago. But it's kind of knowing what is a true emergency and what is something that can wait an hour, a day, perhaps, or whatever. So let's start, obviously, the true emergency. We're talking about life and death situation here. Obviously, there is no substitute for the emergency room at that point. What are some of these conditions where you should immediately, if you're feeling any of this or experiencing any of this, you better get to an emergency room stat, as they say in the medical profession?
Sure. So some examples would be if you're having chest pain, so potentially having a heart attack, or if you think you might be having a stroke, so experiencing symptoms of sudden numbness and slurred speech. If you're having severe burning or severe bleeding, if you are having some difficulty breathing, if you have any symptoms that you reasonably think might be causing serious jeopardy to your health or might be life-threatening.
Okay. What about in cases where, I mean, it's tough. You're thinking to yourself, this is awful. I can't keep doing this for another day. What's the best choice in that regard? Is it the urgent care centers that we see popping up in so many communities these days?
So urgent care centers are a great alternative to the emergency department. The waits are much shorter, about 30 minutes, so at least a third shorter than emergency departments. And many people know from personal experience the waits in emergency departments can be even longer, up to several hours. So urgent care centers are a great option if you have non-emergent medical care, but still feel that you require some treatment in, let's say, the next 24 to 48 hours.
What are some of those conditions that are probably better suited for an urgent care center than an emergency room?
Sure. So some examples of conditions that can easily be treated in an urgent care center are things like sprains and strains, nausea, diarrhea, ear pain, sinus pain, mild headaches, urinary tract infections, minor allergic reactions, coughs, sore throats.
Okay, you're starting to hear of retail health clinics. Is that just another name for an urgent care center, or is it actually something different?
So retail health clinics are somewhat different. These are located typically within drugstores or major retailers. So an example might be Minute Clinic, which is often co-located in a CVS store. They're not standalone facilities like urgent care centers, but they can treat many of the same conditions. They're typically walk-in, and they can help, again, with conditions where you might have a sudden need for care, but it doesn't rise to the level of being a true emergency. And they are significantly shorter waits, just like the urgent care centers, and overall much less expensive.
Okay. You mentioned virtual care, and during the COVID pandemic, that was most of the time your only option, right? Other
That's
than the
right.
emergency room. And it stayed popular afterwards. The convenience of it, to me, is the kind of the reason why. Look, if you don't have to leave your house,
Yeah. It's great. Or you have transportation challenges or childcare issues. It's a great option.
And often you're getting that virtual visit with the same person who would have seen you at a doctor's office or at an urgent care center anyway, right? You're getting
Right.
nurse practitioners, doctors, et cetera, right?
Right. So sometimes you can even get a virtual visit with your own primary care doctor, but if they don't have availability, many virtual care options exist. Often through your health plan, they'll offer a vendor to provide these services. And you're right. These telehealth visits are typically with a physician, a nurse practitioner, a physician's assistant, and there are a range of conditions that they can treat, just like in the urgent care centers.
Okay. Of course, some folks think virtual, like, oh, I'll just go on the internet and I'll start Google searching. As someone who Google searched back when I had to do a cardiac procedure and scared the living daylights out of myself, medical professionals generally don't want us going and trying to self-diagnose on Google or, when AI starts to take over the world that way either, right?
So if you do want to educate yourself on the internet, it's always best to consult with your primary care provider and ask for reliable sources. There are some reliable sources, but there are many sources that just aren't reliable. So always check first with your primary care provider. And again, that virtual care may be a great option, very inexpensive, and typically only a 10-minute wait to access those services.
All right. And of course, Inside Lowell podcast viewers are fortunate to have you giving us some advice on this, as do everybody who is a member of the Wellpoint Health Network. You guys also have, Wellpoint also has the Sydney Health app, which I would imagine
That's
is
right.
kind of the most convenient form of virtual care, right?
Very convenient. So they can access virtual visits through our Sydney app. And so again, there are many, many options. And I would encourage individuals to think about these alternatives rather than resorting to the emergency room. Better care for minor conditions, less of a wait, and much lower cost to you.
And much less aggravation in
Much
most
less
cases
aggravation.
as well. All right, Dr. Langer, as always, thanks for joining us here. We'll see you in December.
Great. Looking forward to it. Thank you,
All right.
Teddy.
We are as well. We thank Dr. Langer, and we thank you for joining us here as well for this latest Health Minute sponsored by Wellpoint. Till next month, everybody stay safe, and hopefully with some of what you've learned with this podcast, you'll get to stay healthy as well. Take care.